Good afternoon, everyone. Thank you so much for joining us for this July Forum Online. My name is Maggie Christian. I'm the Operations Director for the La Crosse Area Chamber of Commerce. And before we get into today's presentation, I just want to run through a couple very quick announcements with you. First is just a Zoom reminder. Everyone came in muted. So if you would like, you can share your video. Otherwise, your videos are also off. And to ask a question, since we do have a pretty big group, I would just ask that you would enter it into the chat, and then we will just feed that to Emilie and Aaron as the presentation gets going. So first, for some big updates, in case you missed it, the application deadline for the PPP was extended to August 8th. So there is still funding there. If you are eligible and you haven't applied yet, please do so. I would recommend the SBA.gov. They have a very thorough guide for eligibility, how to apply, as well as loan forgiveness and some frequently asked questions. So second, effective this morning, I believe it was at 8 a.m., Dane County, the mask mandate went into effect for the entirety of Dane County. So that requires everyone over the age of 5 to wear something that covers their nose and mouth whenever they are in an enclosed space that is not their home. And there are some exemptions made, so feel free to go ahead and look up those exemptions if you are interested in them. And then last but not least, last week we were pleased to partner on a new initiative for La Crosse County called Check the Spread, with the goal to curb the spread of COVID-19 transmission in our community. We have some really great partners that we joined into this initiative with. So the La Crosse County Health Department, the Weber Group, Downtown Main Street, Explore La Crosse, Gunderson Health System, LADCO, Mayo Clinic Health System, and the Tavern League of Wisconsin. And if you haven't already, I would highly, highly encourage you to please visit checkthespread.org, and I'll put that in the chat in a minute here. Make the pledge, and then also make sure you view the list of businesses. There's dozens of businesses that have already committed to keeping our businesses and our community safe. So please, please, highly encourage you to check out that website. So with that, you should all be seeing Aaron's screen right now. So we will move on to just the main forum presentation, and I would like to welcome Emilie Amundson, who is Secretary of the Wisconsin Department of Children and Families, and Aaron Arango Escalante, who is Administrator of the Division of Early Care and Education. So Emilie and Aaron, thank you so much for being with us today, and you have the floor.
Great, thank you so much, Maggie and Joe, for the invitation to come and chat with you all today. I'm going to apologize in advance if my video gets a little glitchy. I don't think I've had one Zoom meeting so far where it doesn't freeze on like a really unattractive place where I've got my mouth open or something like that. So just be prepared for that at some point. And then also enjoy the sounds of my neighbor re-roofing his house today in the background, which is always great for these kinds of things. So apologies, but I think we've all become very accustomed to this kind of interruption. The other interruption that may or may not happen today is interruptions from my 6-year-old or 8-year-old who I'm currently co-working with. This job here at the Wisconsin Department of Children and Families is absolutely near and dear to my heart, and being a working mom, it really puts a fine point on the topic of today's conversation. So measuring the economic impact childcare. And Erin and I are so fortunate. We feel very fortunate to, number one, work together and to be part of a conversation about the future of child care and of early education generally in Wisconsin. And so we'll get into it. What we're going to do today is spend a little bit of time talking about the national context, sort of what makes Wisconsin not very unique, when we talk about child care and when we talk about sort of where we're at from a national picture. Then we'll talk a little bit about the opportunities and kind of like where we are as a state right now. We do want to touch on kind of what COVID added to our current climate and our current picture. And then we want to leave you with some ideas about both some opportunities that are happening this year in Wisconsin at the nexus of economic development, workforce development, child care, but also some things that you can do as leaders in your community, as business leaders, to really grow the conversation about child care as a backbone industry. And then we'll protect some time for questions, and we're happy to field any questions that you might have. Erin and I are probably going to talk over each other a little bit and interrupt one another because that's generally how we present. But Erin, why don't you click to the first slide and we'll get going here. Okay, so we want to provide the context that, yes, we're talking about childcare today. We're talking about, in-home care. We're talking about in-center care. And we're talking about why childcare is so important to, getting folks back to work in the current climate that we're in. But why, in broad strokes, childcare and early education is so important to long-term sustainable economic development and economic impact. We want you to understand that it's a much larger puzzle than just the child care piece. So all of those programs that you can see listed below, from home visiting to all of the sort of well baby checkups, parenting support, and support for one another, new parents and things like that. The 4-year-old kindergarten. Wisconsin was the birthplace of America's first kindergarten, and we were also a pioneering state for 4-year-old kindergarten. So when we think about early education in general, yes, we can talk about childcare, and today's conversation is very squarely focused on childcare, but that context of early care and education involves so many more players. It involves my colleagues at the Department of Health Services. It involves my colleagues at the Department of Public Instruction. And there are programs across the healthcare industry that absolutely are part of that big early care and education puzzle. So next slide, Erin. And the reason that that's important to think about is it's that whole puzzle, that whole big kit and caboodle that is the real return on investment. So yes, childcare, high quality childcare is part of it, but when we start to talk about all of those programs and sort of the net gain that they provide for every $1 invested, that's where you start to see some really, really exciting long-term ROI. So, when you have this sort of high quality cross-system support network for families, for children, for communities, you start to see things like less remedial education, higher graduation rates, lower teen pregnancy, lower rates of incarceration. And you can read down the list just like I can, but just even to get to something like better long-term health outcomes. Some of the things that we see, and this is just an anecdotal story, when we talk about some of the opportunities through COVID to develop our own chops as online learners, a lot of the Head Start centers developed kind of mechanisms for reaching out to parents via Zoom meetings like this one or online parent support groups. And what they found is that they've really been able to sustain this sort of community support mechanism, even in the current state that we're living in, more of a virtual technology environment. And even then, it's that community mindset, it's that support network that I think is going to lead to the kinds of return on investment that you see on this slide. So that's why we care so much about this. We really believe it's one of the best investments that we can make as communities. It's incumbent on us connecting those dots across sectors. It's incumbent on us talking with one voice. And this is something that I've said in a number of forums in the La Crosse area. So this isn't something I say to every chamber that I'm talking to by any stretch. La Crosse County does an unbelievable job of connecting those dots across sector. Your collective impact model and the work that La Crosse has been doing to articulate how these different sectors talk to each other about supporting family and community is really, I would say, state-leading work. And it's something that we've thought a lot about in some of the programs that we're trying to develop vis-a-vis the grant program that Erin will talk a little bit more about later in our presentation. So I want to give big kudos to La Crosse and that area of the state for really seeing the need to create that supportive network across those programs to support kids and families. Go ahead and click the next slide, Erin. And then just a little bit on measuring the economic impact of childcare. So as we know and as we've seen from the COVID crisis that we've been living through, when we don't know where our children can go, will go, where they will be safe, it really creates a break in the system. It means folks can't go to work. It means folks are home with their children all day. That is the reality that I've been living with for the last 6 months. Pre-COVID, we were in a crisis. It was just kind of a quiet crisis. So 78% of parents of children under 3 are in the workforce. But what we find when we survey them, and we've done a fair amount of this, particularly in Western Wisconsin, is we find that the stress and strain of constantly wondering where will my children be safe, where can they get high quality care, what happens if somebody gets sick, or is my care to be trusted? Can I rely on the folks that are caring for my children to be there week to week? All of that takes a really significant toll on really productivity and just general workforce happiness, general workforce stress. And so you can see that data point there. 86% of working parents said problems with childcare hurt efforts and time commitments at work. And this is something that I think business leaders, it's really incumbent on the business community to survey staff and say, what is it about childcare that is really most stressful or most vexing? What might be our role in helping to mitigate some of that? The upshot of that is $57 billion in lost earnings, productivity, and revenue across parents, across business, across the sector when we factor in kind of the lack of care and the undue strain and stress in trying to secure care. And then that fourth bullet there, a third of high potential women dropping out of the workforce every year because of child care challenges. So child care deserts are real. There's something Erin will talk about in a minute when we talk about access. But really, when you're a working parent and you're faced with the decision of sending your children to less than adequate care, maybe a less than high quality center, or maybe a center or a situation that doesn't feel stable or doesn't feel secure, you're often asking yourself the question, well, should I just give up my job? Should I just back out of the workforce? And so these are conversations that I have with my peer group quite frequently. They're conversations that I've had with my spouse. And so that even for two, relatively well-employed folks, it's really a yearly conversation about the challenges of really meeting the needs of our children in childcare. So that's a little bit of national data picture for you. And that's certainly very similar to what we see in Wisconsin. Now, Erin and I came into the administration, Evers administration, January of 2019, and this is really the picture that we inherited. I knew coming in, so my background is in teaching. I worked at the Department of Public Instruction for many years, and I knew coming in that I wanted to shine a light on early education, on childcare, and that I really needed somebody who was going to fight like hell right along with me to make sure that we made measurable and impactful gains in our childcare picture over the 4 years that we hopefully have. And that person was Erin Escalante, so I was really pleased that she was able to come on and help with this puzzle. So I want to ask Erin to give us a little bit more of the context here in Wisconsin.
Absolutely. Good afternoon, everybody, and thanks for having us. So I like to use this particular framework when we're thinking about childcare in Wisconsin. And again, this is very similar to what we see across the nation. But I want to talk about, again, this framework. And it's set up in a way where there are really 4 core buckets: access, affordability, quality, and workforce. And they're very distinct yet interconnected categories that we look at childcare in Wisconsin. The other piece that I want to make sure that I mention is that we always look at these buckets with the lens of equity and inclusion. So that is really, really key as we do this. And so just touching base, that lens of equity and inclusion as we develop policies, procedures, systems, implementation at the local and the state level has been very, very critical, and it's interwoven in everything that we do. So Emilie really gave us a good picture of access across our nation and how access impacts the workforce. I'm going to go a little bit deeper with Wisconsin and where we are at. And so approximately, and this is in February of 2020, so approximately more than 50, it's actually 54% of the zip codes in our state were considered childcare deserts. And essentially a childcare desert, a zip code is a childcare desert, means that there are more than 30 children and there's only 1 spot in childcare for every 3 children. Childcare deserts are a real thing. We see it to different extremes across the nation. And I can say in particular, in the west, in the northern parts of our state, we actually get up closer to 80%. It is extreme. It is scary. It is a real thing. And I just want to make sure that you see the landscape. Again, this is February of 2020, that we had roughly 44,500 programs with roughly 175,000 slots for children. And this is children that are infants and toddlers, all the way up then to after school and before school programs. Over the past 10 years, we have seen a significant decrease in the number of in-home family programs. We have seen a slight decrease in our larger center programs, but that's been the trend. It's been headed that way for the past 10 years. I will say too that in the western part of our state, we see primarily in-home family programs and not as many group providers. So here's what it looked like, each of our counties looks like in February of 2020. You can see if you look in the north, you look in the west, you do see fewer. In many counties, there are less than 25 providers. In one county, there is a provider. So I just want to share with you this map and what it looked like back in February. I'm going to fast forward now, and I'm going to look at May. We have seen an increase in the percentage of families who live in childcare deserts. That exact percentage right now is unknown, and it's unknown because we have a number of childcare programs that have temporarily closed. So in May, we saw, we lost about 2,000 programs that ebbed and flowed in March and April. In May, that's where we landed. You can see there's, less than half of the slots for children available. We lost, and this is in the Southeast, we lost 61% of our larger centers. They had to either temporarily or permanently close. We saw actually to a lesser degree of programs closing in the West and in the North, and primarily because there are very few programs there. What's interesting is we saw the flip occur in terms of family childcare, and it makes sense because there's typically 8 or fewer children in family childcare programs. And so in May, we saw 84% of those programs, they were still operating. And those programs consist of about 11,000 slots for children across our state. So it's really important to know, though, that it's flipped itself, that historically we saw a decline of group providers, a decline of family and in-home providers, and yet more steady group centers. But as we see this pandemic hit, and really as in the last few months, we have seen a shift. So that's our world of access right now. I want to now switch to affordability. And as you can imagine, along with access becomes affordability. When things are more difficult to find, supply and demand does go up. So here's the median income comparison for the cost of licensed care, and this is at a group center. So if you have basically a 2-income household, your child care expenses are roughly 25% of those who are at the median income comparison. Now, if you are a single parent, it goes up to 50%. 50% of your earnings, or your income, is then used on child care. This is, just so you know, as a comparison, we are exceeding the cost of in-state tuition as well as rent for 1 year. And that is the cost of one child. Imagine having more than one children in childcare, so under the age of 4 or 5, or having twins. It's a scary number when we go. No, I want to just be really clear. This is affordability for parents. Affordability for providers is another piece to this puzzle. Let me just say, childcare providers run on razor-thin margins. I can't stress that enough. The cost for 80% of a childcare budget goes to staff salaries. Right now, we have increased, obviously, our sanitation and our disinfecting procedures. There is a charge to that. There's a charge for PPE. There's a charge for all of the things that we are doing, smaller ratios, etc. So I just want to make sure you know that the affordability is an issue for parents as well as providers. So now I've taken 2 counties, and this is the average price for an infant child for a group center. And as you can see, I use Chippewa County as well as Dane County. So it's a little over $1,000 per month. And we do have families that are eligible for Wisconsin Shares Child Care Subsidy. And the maximum reimbursement amount, as you can see in Chippewa County, is $761, which does leave a gap of $270. Look at the percentage of zip codes that are considered child care deserts in Chippewa County. We're at 63%. When you compare it then to Dane County, which has has more programs, a lower percentage of child care deserts, and that maximum reimbursement rate does go up based on the average group price. So I just want to make sure that you see the difference in affordability and how there still is that gap that is there for all families, whether it's families who are private pay families or those who receive Wisconsin Shares. So now that we looked at access and affordability, I'm going to turn to quality. So in our state, we are measuring quality with our quality rating improvement system, which is called Youngstar. Youngstar has been around for about 10 years. We have seen somewhat of a decline in those who are participating in our Youngstars program. how we look at our Young Star program is programs that are a 3, 4, or 5-star are considered high quality. And you can see of the 81% of all of our regulated programs that participate in Young Star, 41% of those programs are considered high quality. The other 36% that you see here are 2-star. So that means they meet basic licensing requirements. And then we have some folks that are meeting basic minimum requirements, but are decided that they don't want to be formally rated, and that's 19%. We also have a small subset that, due to the pandemic, have not been rated yet, but want to be. So I just wanted to share that breakdown of how many programs, or the percentage of programs that are participating in Young Star are considered high quality programs.
And Erin, would you be able to just quickly explain why a center would make the decision not to participate, and then, you know, and I know that there are myriad reasons, but also then what does that mean relative to the subsidy program?
Great question, absolutely. So in order to receive Wisconsin Shares Childcare subsidy, so a family who is eligible and authorized to receive that subsidy, a program must be a participant in the Young Star program. So they need to be demonstrating at a minimum 2 stars, which is, again, meeting that licensing requirements. So they're in good standards there. They're doing well, and they have applied to be in the program. They, at a 2-star level, there are certain educational requirements. There are certain professional development needs. There are things that you have to do within your program. As you move to the 3, 4, and 5 stars, there are different added financial incentives at the 4 and the 5-star. So you get a additional percentage of like a bump, a quality incentive bonus for each child and it goes higher with 4 and then 5 stars. But in order to participate in Young Star, again, you have to be involved in the program. So in each of these categories here, you can accept children with Wisconsin Shares. The issue that comes into play why a number of providers do not participate is a couple of different reasons. One, and this is the next topic really, is workforce. Many times folks are struggling to find workforce that meet these minimal requirements. On average, and I'll just touch a little bit on workforce, on average, our workforce makes on the low end $10 on average. It goes lower than that, and on the higher end, about $13 an hour. So recruiting and retaining staff is an issue, and in order to provide high quality care, you need to have staff that are well-versed in child development, that understand developmentally appropriate practices, and that understand all those key licensing regulations, standards, and administrative rules. And so that's one of the biggest reasons. The other piece too is that we find that there are in some counties that there are very, very few, if any, children participating in Wisconsin Shares, and so they choose not to participate in Young Star. There's a lot of reasons why, and it's also something that we're looking into in terms of that participation level and what is holding people back. We're looking at the definition of quality going forward. So there's a number of things that we are wanting to really dig down deeper and better understand Young Star and how it's evolved over the 10 years.
Thanks, Erin. I wanted to make sure people kind of understood that, because if you remember back to the slide that Erin showed with the teeter-totters and kind of the gap that's left between the tuition charged and the Wisconsin Shares maximum payment, to me, it feels like kind of a ball of wax that's all sort of tied together. So we've got, programs that need a certain level of quality in order to qualify for Wisconsin Shares, but once they have that quality, they need a certain credentialed workforce to be able to provide that quality and maintain that quality. that certain credentialed workforce needs to be paid a wage that would compel them to work in a child care setting rather than go down the road to Quick Trip and make $5 more per hour and also get benefits on top of it. And what that leaves the family who would qualify for Wisconsin Shares, that leaves the family essentially priced out of that high quality care. Those become the folks that then decide to leave the subsidy program altogether and look for care in less than ideal places. And so that's really, that in a nutshell is the problem we're trying to solve here in Wisconsin. Back to you, Erin.
Spot on. Yeah, that's spot on. I mean, you're right. We do see families that are leaving regulated care and going to unregulated care. And there is, it does get scary. It does. And so, and that's not because families do not want their children to be in high quality care. It's because they can't afford it. And that's how all of these are so intertwined. You know, if you shift one of them, it wiggles the others. And so let's talk about workforce now. And I am going to argue that early care and education providers across all of the sectors play one of the most important roles in educating Wisconsin's future leaders. It is a key role, and we know in that 0 to 5, the amount of development that is occurring and setting children up for future success is incredible. And so again, I think it's one of the most important jobs. In Wisconsin, we know that more than half of our teachers have at least an associate's degree. And here on average, here's where their earning is, the actual average is $10.72 an hour versus $18 an hour, which is what others with an associate's degree often have on average. This is $2,000 less than other childcare professionals in other states. We know that more than half of our teachers in childcare qualify for some sort of public assistance, whether it's childcare subsidy, whether it's SNAP, WIC, CHIP, W-2, you name it, whatever it might be, they more than likely qualify. We also know, based on these low hourly wages and based on a number of other factors, that we have a pretty significant turnover rate. And this is consistent across many, if not most states, about 40% of a turnover rate. Now imagine that from a business perspective, that is a high turnover rate. The amount of time it takes to train and to help people get up to speed in childcare, whether it's professional development, understanding all the processes, the procedures, child development, getting making a rapport and a relationship with families takes time, and that turnover rate is very, very difficult. Hence why we also run on razor thin margins, unfortunately. So again, I just wanted to go back to how all of the pieces fit together, and we make decisions on anything, any policy or practice related to each of these areas. It does have an equity and inclusion impact, no matter which way we look at it. So there are situations when we have fewer providers, lower access, it does cause an equity issue, affordability, quality workforce. We see it across the board, and we want to make sure that we are truly focusing on moving the needle to support families in being able to make or provide high quality early childhood education opportunities that meet the needs of their families in their communities. So that is our goal. And now I'm going to turn it over to Emilie, who's going to talk now about this particular framework and how we have looked at it during COVID-19 and with the CARES Act funding. Emilie.
Thanks, Erin. So, I think the picture that Erin painted for you about both the national context but also the Wisconsin climate is that childcare was already pre-COVID a sector that needed help. It needs help across a number of those different platforms, but really a sector that has been identified as a sector in need. And some of the federal opportunities that we'll talk about in a few minutes when we get past the gloom and doom section of our presentation are really intended to start to address this in a systematic way across states. And we're really, really proud of the opportunities that we see in Wisconsin because we've got some amazing early educators. We've got some super smart, talented policy folks. And we've got some folks in the business community and across other sectors who really care a whole heck of a lot about early childhood education. And so we're well poised to deal with a lot of the issues that Erin presented in the first part of the presentation. That said, COVID-19 and the crisis that ensued from March was not helpful to the early childhood sector. Folks, when schools closed back in March, childcare did not have that option. We asked our providers to stay open if they could. We knew that at that critical crisis moment, if we were to create an environment where our first responders, our essential workforce, were not able to access high quality, affordable childcare, we would be in a really significant deficit for fighting what we knew was going to be really the challenge of our lives around COVID-19. And so we asked, and we got on conference calls with providers across the state, and the governor asked child care providers, please, if you are able, stay open. Some were not able to. In fact, what is it, Erin, over 60% needed to close for some period of time. But the folks who stayed open and stayed safe, and they kept our children safe. And because of that, I think Congress recognized the power of childcare as a backbone industry. And I think that childcare has started to have a moment nationally where it really is seen as, we can't make the decision to come back online. We can't make the decision to start our economic engine again if we do not have a strong, robust network of early care options. And so this Child Care Counts program was designed to really support our child care industry through the back end of the pandemic and kind of offset some of those initial costs, both for programs that remained open through the entire course of the pandemic, but also for programs that needed to shut down for any length of time. What we found is getting those programs back online was a difficult proposition. Re-establishing supply lines to PPE or to sanitation products and cleaning products was incredibly difficult. Retaining the workforce during COVID-19 and making sure that there was a high-quality workforce to be able to get the system up and running again. And so we received a set-aside of $51 million from the Federal CARES Act and designed programs, 3 different programs, again, one for open centers, one for centers that needed to temporarily close, and one program that went directly towards subsidizing the wages of the workforce who worked through the pandemic and continue to work through the pandemic. So this was a supplementary salary stipend that folks could access. We're really pleased. We'll be able to say that we've put the whole $51 million out by the end of the month. Almost 3,000 child care providers will have been helped by this program, to the benefit of 75,000 Wisconsin children. And then, almost 20,000 child care workforce able to stay employed and receiving pay through this pandemic. So it's been an absolutely trying time. I won't sugarcoat it. It's not easy today. It won't be easy as schools are grappling with their plans to reopen. I think that's currently the conversation that's giving Erin and I gray hairs and keeping us awake in the night, is thinking about these school reopening plans and the impact that they will have on childcare, and will there be a strong enough backbone within that childcare industry to support what school districts are asking of them, and sometimes not asking of them, just assuming. And so I think that's that's a challenge that we need to all sort of grapple with is, are our early care and education providers at the table as these plans for reopening are being drafted? Because if they're not, we're leaving out sort of out-of-the-box thinking, innovation, and potential partners in helping to solve the puzzles around safe reopening. The other thing that I will say is that, in the midst of a pandemic, when we were learning something new about the virus every single day, our early care and education providers were being as nimble as possible, learning new things, keeping kids safe, developing new sanitation protocols, developing new protocols for how kids interact with one another during this day, how parents interact with teachers. And really, it's heroic work. And I think that that's the other message, that there's one thing you take away from today's presentation. It's that these early care and education workers who worked during this pandemic were doing heroes work and really turning on a dime to be able to meet the needs of families during what was a really, really crisis moment for us in our state. So a little bit on that. And now we want to talk to you a little bit about the opportunity that we see moving forward because of some successful grants that our state has been awarded in this field. So I'll kick it back to Erin. And Erin, you're on mute, I think.
Thank you. Thank you. There are opportunities right now, and although we've gone through a roller coaster, all of us, of events, of different ways of working, there are two opportunities that I want to share. And these opportunities align with the framework that I just showed 100%. We wrote two grants. The first one is our preschool development grant, and we were awarded that grant in December of 2019. It's a $10 million 1 year, calendar year 2020 planning grant. And that is very much, it was 100% aligned to the access, affordability, quality, and workforce within the context of equity and inclusion framework, and really looking at how do we move the needle? How do we make sure that all of our Wisconsin families are going to have access to high quality and affordable local early care and education opportunities that meet the unique needs of their families? So that particular grant, again, was 1 year. It was for planning purposes, and it's $10 million. There is a round 2 of the preschool development grant that will be out later in 2020, and that will go for another 2 years. Wisconsin will apply for that next grant as well. That's where we get to really looking at by 2023. That is our timeline. In addition, Wisconsin, and this was in January, was awarded the Preschool grant. So this is a 3-year grant that is focused exactly on the same thing that our preschool development grant is focused to. It is aligned. It has an intentional focus on infants and toddlers. The reason being, and this is not any different than other states, is that infant and toddler care is very difficult to find. So there's an access issue. It's an affordability issue. That it's a very, very expensive as well. And it's due to the smaller ratios that we have. And it's, again, consistent across all states. Along the quality, infant and toddler care has a different, folks who provide that care, there's a different skill set in understanding infants and tots. And with workforce, oftentimes our infant and toddler teachers actually get paid less. So I just wanted to share why we're doing some intentionality there with our infants and tots, but really looking at this from the birth through 5 lens. So as part of both our preschool development grant and our Pritzker grant, we are connecting dots across all of our sectors to make sure we can reopen and strengthen Wisconsin's economy. That's really what this grant is about, is connecting dots. And we want to be very, very intentional and look at, of course, our usual allies that we have at the table. And that was really the first slide that Emilie shared with regards to who are all our early care and education folks at the table. Head Start, 4-year-old kindergarten, home visiting, I mean, I could go early childhood special ed. I could go on and on and on. However, this grant, yes, connects those folks, but it goes beyond. And it goes to our unusual allies like you all, our business community leaders, as well as others in economic development, in housing, in health, tourism, corrections. I could go on and on and on. And that's really what we're doing, is looking for those unusual allies that typically aren't at that table. And we are building a bigger table to be inclusive, because the issues in early care and education that we've seen under access, affordability, quality, and workforce truly impact everybody. They really, really do. And so as part of our preschool development grant, we are doing 5 core things that have to be done. These are requirements. We need to develop a statewide as well as very specific regional needs assessments. The needs in our regions look different. As Emilie said, the West, it looks different. La Crosse has been a booming community that's really been looking at shared service model networks, and looking at how to support early care and education and providers. It looks different in the North than the Northeast, than the South, in the South. It just does. And so we want to be very cognizant of the regional needs, yet roll it up into a statewide comprehensive needs assessment as well. In addition, and I should say as part of those needs assessments, we are in the process of hosting listening sessions. Now, we have had one listening session actually last week for the West. I believe we had over 70 people just attend that one listening session. We're going to have additional ones, and I can share with you about that information. But the information that is shared during those listening sessions goes right into our needs assessment. We want to hear from everybody, including you, our business community leaders. So then what happens is our needs assessment are what drives then our statewide and regional strategic plans. We want to make sure that we are being very intentional about those plans, that they are addressing the needs, the gaps, the areas that we can move the needle on. And at the same time as we're working on this work, we are able to then work with informing parents, businesses, business leaders, other stakeholders about what exists in their area, in their communities. What are those options and opportunities? And then also focus on sharing best practices, both within, among, and across our communities. So looking at the various regions, what's working in all of these different communities, and how do we build on those best practices? And then finally, we are looking to again, move that needle in improving access, affordability, quality, and workforce issues that we see. That is directly connected to what our strategic plan says. And we are going to be offering innovation grants for regions that align to strategic plans that truly share those best practices, that are working with families, businesses, and others to be able to move the needle. So that is our preschool development grant, the 1-year planning grant. And again, I can't reiterate more that our Pritzker grant is absolutely aligned to that work with an intentional focus on infants and toddlers. So I did just really quickly mention that preschool development grant it does have a very systematic and sustainable structure. And in fact, our governor, First Lady, and all of our cabinet agencies, plus our Department of Public Instruction, is involved in this grant. So it is our Leadership Council on Early Years. Our Governor's Early Childhood Advisory Council is involved, and we do have work happening across the agencies. We have work happening in each of these regions, and so I encourage you to get involved. Here we are in the West. There is a West group, and we can happily connect folks to the work that's happening in the Western region. Happy to do so. And we can share more about where to find that information in the next few slides.
Yeah, so we promised to leave you with some concrete, tangible, short-term and long-term ideas. I think Maggie also has a handout that will flash on the screen, but also try to make sure that we put in your inboxes. It's hot off the presses. We just completed it this morning. But really in the short term, so the listening sessions that Erin mentioned as part of the preschool development grant, we'd love to hear your voice as part of the listening session. I think it's going to take, my personal opinion is it's going to take folks outside of the early care and education community to be able to amplify this issue enough for it to be resonant with folks. I think too, in the short term, just thinking about family-friendly workplace policies. I'm sure so many of you have had the opportunity over the last few months as we've had to shift and sort of flex and do things a little differently, to be just thinking about what are those benefits, am I a family-friendly employer, and what does that mean? And specifically, what does that mean for what I'm doing in that child care sphere, if anything? And then on the longer term, a few concrete ideas there would be, so obviously looking at those workplace policies, but I think that idea of how can you as a business leader or somebody who works within an organization invest in child care programs that are close to your site. So, you know, treating employee child care costs like the way that you would a subsidized health care would be just an incredible benefit to employees. Thinking about shared services models, so many of the things that you do each and every day as a business leader that don't necessarily come naturally to the child care workforce. So Erin mentioned that we're seeing an uptick in the number of families outstate that are interested in in-home childcare, and that makes a lot of sense to me as a mom, thinking about those smaller spaces for where I want my children to be safe, you know, in these uncertain times. Well, those folks didn't necessarily get into the business of childcare because they loved, you know, the accounting side of things, because they loved running the numbers and doing the books and running the business angle. What we're seeing is some really great emerging best practices around shared services models. And these are things that the business community could really, really help with. And then I think lastly, just using your influence. So I'll call out the chair of the Council on Workforce Investment, Mark Tyler. He has a particular passion in, he's a business leader, he runs a fabrication company, but he has a particular passion for early childhood education, and he has used that platform to really amplify the issue within the Council on Workforce Investment and within spaces. You know, the Wisconsin Economic Development Corporation just put out an awesome brief about sort of moving beyond COVID-19, and childcare again is seen as a backbone industry. I think the more that we as the business community and business leaders talk about childcare as part of the backbone of how we keep Wisconsin strong, really it'll go a long way. So Maggie, I would just say, I know we're pushing up on our 1 o'clock here. Sorry to have taken so much time, but that one pager would be, we could put that up right now. And if there are any quick questions, we are more than happy to field anything. So happy to answer any questions that folks would have at this time. But again, this one pager was developed for business leaders to really try to help give some tangible, concrete ways that you might be able to help this industry. Any questions at all from the group? Can you hear me? I can.
I think your chat is disabled. At least for me, it's not working.
Okay, thanks for.
Did you want to ask a question verbally?
Sure. And this goes way back to the beginning. I just missed it. Can you mention the definition of childcare desert for me by chance?
Sure. Erin,
Sure.
you want to take that one?
Yep, absolutely. So any zip code that has 30 or more children residing in that particular zip code, and that has one slot available for every 3 kids, is where the definition of a childcare desert comes in.
Awesome. Thank you.
Sure.
Any other questions?
I
We
believe-
are very happy. Yeah, go ahead.
I was going to say, I believe the chat is fixed. Let me know if you can see this.
Yep.
Are people
I can
seeing
see
that?
it.
Okay.
Yeah. And Erin and I are always very happy to talk. If you want to, something we said sparked an idea or a question, we are very happy to talk about, to have one-on-one conversations with folks if you've got ideas. I see a question here of any school districts reach out to your agency specifically for advice on reopening. What general advice do you share with them? So yes, I mean, we're working almost daily with our colleagues at DHS and DPI to work on trying to build out school reopening plans. You know, the feedback that we've provided to school districts so far has been really what I tried to say in this presentation, which is that we need to look to our childcare industry as really experts and leaders in how to reopen safely. What we have seen is that they have not been hot spots in Wisconsin of spread. They have been, you know, running this entire time without a lot of hoopla. And so I think involving the childcare industry as part of discussions is really, really important. I also think that districts who can leverage their child care centers to either space kids out or explore virtual options within child care centers. So not kids going back and forth between the school district and the center, because that really creates more groups, right, and more risk, but actually placing students in center-based care for their virtual learning. And we have models through the 4K community program that would allow school districts and child care centers to work in that fashion. So those are a couple of innovative ideas that we've been trying to push. I see a question about what do we think, what's going to happen when the child care counts dollars run out, which they will at the end of the month. We are advocating very strongly with Congress. There will be another stimulus package. We think that child care needs a part of the stimulus. There is a day of action nationally on this issue on July 16th. So early educators are going to be out advocating for that funding. And I think that is really there. I cannot envision how the child care industry will be able to get through this particular crisis without another influx of dollars, either from the state or from the federal government. And then why do I think the child care crisis was a quiet crisis? And do I think COVID will increase the sense of urgency? Yes. I think that is, I think folks that I've talked to have really been just struggling trying to piece it together. And I think, to speak from my own experience, again, as a mom, you look and you try to find appropriate care for your children, but it feels very personal to you. And so it's something that you're dealing with on your own. You're just trying to figure it out. And, everybody seems to have a slightly different situation. And yet, when you start talking about it, you realize everybody had challenges pre-COVID. I think that what you see now that, you know, COVID has happened is there wasn't anywhere for the kids to go. They had to stay, you know, at home, and there were far fewer spaces and spots for children to go. So I think what I've seen is a lot more national media attention drawn to this issue, because it really has been something that almost every parent in America has had to deal with in some way, shape, or form. So I do hope that there is a silver lining around around shining a light on kind of the absolute backbone industry that childcare is as part of this crisis. Oh, and thank you to Senator Chilling. Appreciate that.
It looks like there was one other question. Will you be able to give access to the slides so we can share with the viewers and people who weren't able to view?
Absolutely. Yeah, we'd be happy to.
Great.
Great.
Any other questions?
Well, wonderful. I want to thank everybody for taking the time over their lunch hour to do this presentation today. And again, we're happy to chat if anything we said sparked an idea in your community. Erin did mention the collective impact grants. And those are grants that we would frankly love to see innovative collective impact ideas that would come out of public-private partnerships. You know, business communities, child care centers, school districts, health and human service agencies. Get creative, think out of the box, and we're very interested in those ideas. So thanks so much. And again, thanks for the invitation.
Thank you. Thank you, Emily. Thank you, Erin. Thanks, everyone, for giving us your lunch hour. We'll see you in August.
Thank you, Emily. Good to see you. And Erin.
Thank
Bye-bye,
you.
Jen.
Bye-bye.